Hi, everyone. My name is Scott Allen. I'm the CEO of the Family Medicine Education Consortium. And we're here tonight to hear from Beebe Healthcare about what do family medicine residency programs want to hear from you and how to be a stellar family medicine applicant and to hear a little bit more about their program. So thanks for joining us. Before I turn it over to our speaker, I just want to make sure everybody knows who the Family Medicine Education Consortium is, because some of you may be calling in from outside the Northeast US, and that's really our main region. So we are a coalition that serves 14 states and the District of Columbia. Within those 14 states and DC, there's about 60 medical schools, about 190 family medicine residency training programs. So we really serve as a convener and a connector to help them all learn from each other, have presentation experiences. We have an annual meeting each fall that's coming up in about 3 weeks, September 16th through the 18th in Arlington, Virginia. We bring about 300 medical students to that meeting on scholarships, and we have a residency fair where they can meet residency programs. And this year, I think it's almost our biggest. We're gonna have 86 family medicine residency training programs at the residency fair, so that's great. We also do awards, we have learning collaboratives on different clinical topics, and some volunteer opportunities. So we really look at ourselves as a catalyst, a convener, and an incubator. Our main mission goals are to promote family medicine to medical students and hope that they choose family medicine or primary care. We support residents to get into their careers and also give them presentation experience and opportunities at our meeting. And we strengthen academic family medicine by having faculty meet and collaborate and learn from each other. And so with that, I am going to stop sharing my slides and turn it over to tonight's speaker.
Hello all, my name is Dr. Ryan Arias. I am a DO, so I guess I'll tell you a little bit about myself before we get into the bulk of the discussion here. I just graduated residency in, well, 2022, June 30th. I was chief resident in my program. I trained in North Carolina at a small rural program in Harnett. I got some excellent training there in family medicine. I am currently core faculty with Beebe Healthcare. We are having an FM residency program set to begin the class of 2023. So you'll see us on the interview board coming up here shortly. Our program director is Dr. Joyce Robert. She is an excellent person, and just a little blib about Beebe. Since I've joined, everybody has been so accommodating. They're a great entity to be a part of, and they're very interested and very welcoming of having a residency program. So one of the things that we wanted to talk about tonight is sort of the stuff that we want to hear from you in reference to applications and what sorry, I'm trying to double task here, and what you are applying and what you bring to the table and everything that goes along with it.
You muted yourself, Dr. Arias, and you're sharing your full screen, not your PowerPoint. Okay, now we see your PowerPoint, but you're still muted.
Okay, gonna try it a different way, hold on. Is that better? Can you hear me now?
I can hear you, but I still see just my name on the screen. You're just sharing the
Okay. Sorry.
So if you just
See
minimize
everything.
that, you should, there you go. Now you got it.
All right, there we go. Sorry about that. All right. So some of the things that we like to talk about, back to the drawing board. So these are sort of some absolute no-nos when you're applying for residencies in general, and then we'll get a little more specific. And I left that second one there intentionally blank. Not being yourself. This is an interesting phenomenon. Everybody gets nervous, which is fine, we understand. But always try and portray who you are as a person, because that is really what we're looking for. We're looking for people who are true to themselves, who know what to say and how to say it, and can be collaborative and can work in a team atmosphere. And when we sort of sense that that's not going on, it's difficult for us to proceed and, evaluate you as a full candidate. One of the things that'll send you sort of right back to the drawing board in our minds is feigning interest in FM. We are family medicine providers. We love family medicine. We try and practice some of us try and practice as full scope as possible. And we can tell if FM is your quote unquote backup. So always, if you're going to apply FM, don't try and feign interest in it, and be as real as possible about it. And then one of the third things that we can always sort of tell is when you don't know your own application. Sometimes we'll get personal statements and they'll start off with, I always wanted to be a cardiologist. And we're like, wait a second, you're applying to FM. So not knowing your application, and if you did research, and if it was interesting research, some of us may ask you about it on the interview trail. We may ask you some details. If you say that you were a TA for anatomy and physiology, be able to tell us a little about what you did, how that was. So be prepared for questions that are coming straight off of your application that we want to know a little bit more of. Things that we look for. Somebody who's well-rounded. This is, if you got straight A's and you crushed your boards, great. But if you ignored giving back and volunteering or being a part of some interest groups, or didn't do so great when you were on your clinical rotations, that maybe doesn't work out so well. In FM particularly, we like to see people who are focused on the community. And that could be an assortment of things. It can be you were tutoring others. It can be you volunteered at a free clinic. It can be you did some extra shadowing, or you decided that you were going to go out and do some soup kitchens, something that was giving back. And one of the big things that we always like to see are people who are flexible and adaptive. And that's kind of broad, it's very generic. But the flexibility of family medicine is that we do a lot in family medicine residency. You'll do pediatrics, you will do OB, you'll do general surgery, you'll do inpatient medicine, you'll do inpatient pediatrics, you'll do ER, you'll do pediatric ER. I mean, the list goes on, and then whatever sort of specialties that you think you want to rotate in, you can also do. And the adaptability has to be there with your colleagues, because everybody brings something different to the table. And when you bring something different to the table, you have to be able to adapt on their perspective. And you have to be able to recognize that maybe your way of doing it, although good, maybe there's someone else who has it a little better, it's a little more efficient, and you can combine the two and make it the best thing possible for the patient. So, I mean, to be honest, I'd like to open up some questions to the floor and just start firing away. Put it in the chat, and then we can have people moderate, and I'm going to stop sharing the screen and we can go from there.
You can put it in the chat, or you can also unmute yourself. We are all able to speak and show our faces if you want to, so go ahead and do either one. Ryan, maybe while we're waiting for a question, you can tell me, and I'm curious a little bit about the community that the residency program will be located in, where Beebe Healthcare operates.
Sure. So Beebe Healthcare is devoted to Sussex County in Delaware. So that the saying is Sussex County is our specialty. Sussex County encompasses places like Rehoboth, Milton, Milford, Lewis, Millsboro. And these are traditionally some older populations, but now there are younger populations moving in. We have a prevalent community for autism. There is a school here known as the Consortium that helps with developmental delay in autistic children. There is an LGBT community here. There is a migrant farm worker population around here. We also have an interesting population of chicken factory workers that we serve as well. So you get a pretty broad and diverse sort of thing. And as I'm still waiting to see some questions pop up, our faculty that we have is very diverse as well. I have interest in OMT and POCUS, and I have special interest in some sports medicine and nutritional type things. One of the other faculty, Dr. Lamore, she does obesity medicine. Dr. Henry has a special focus in population health. And our program director, Dr. Robert, is sort of the quintessential family medicine doc. She loves to do a little bit of everything. So we got one here. What is the best way to answer "tell me about yourself" question without repeating what I have in my CV? So that's a great question. The best way to answer it is just to be honest. We want to hear what you like to do, who you are as a person. Your CV might list all the accomplishments that you've had and what you've done for working. But when we ask that question, we want to know who you are as a person. So Falaki Adeli, I'm sorry if I really messed that up. You could practice with me. Who are you? Tell me about yourself. Yeah, all right, that's okay.
Can you hear me?
Yes.
Oh, okay. Hi. Thank you. My name is Falaki Adeleye. I'm a foreign medical graduate. I currently work as a clinical trial coordinator, managing over 5 clinical trials at the moment, which cut across different age groups. I completed my internship program in Nigeria, and thereafter I proceeded to work for 1 year as a resident physician, managing several chronic illnesses and acute illnesses. Thereafter, I located to the United States with my family, and since relocation, I've had extensive hands-on clinical experience working with different family medicine attendants, and have also been involved in both clinical research and and I have 4 publications. Have volunteered for over 10 years now. I've been involved in several community outreaches, which focuses on educating people and sensitizing them so that they can make informed decisions when it comes to their health. During my spare time, I love to cook. I have a special delicacy which I prepare, and there's no one who has tasted this that's never asked for more. I love to swim, and I also love to take my kids to theme parks. We like to just go there, ride on roller coasters, and just scream and shout. And that's really fun. I'm looking for a program where I'll be trained to become a well-rounded physician who is able to provide holistic, compassionate care to people around me, especially people in the underserved community. Thank you.
Well, that was just simply phenomenal. That was very good. And I appreciate you sharing that story with me. That was very good. I think that's a great way to tell us about yourself in a short period of time. So I got here, how is the curriculum built with inpatient/outpatient and call schedule? So that is actually, there are some certain things you have to do for ACGME, but it is highly program dependent on how it is scheduled and the amount and frequency that is done. And it depends on the resources in the residency program. But in general, you know, the first year is more, your intern year is kind of more inpatient based. You do a lot more hospital kind of stuff. And as you go up in residency years, you begin to see more outpatient kind of schedules. Call schedules will vary depending on how many residents there are per program, per year. So that's a highly variable question. But in general, there's certain markers that each program does have to meet, but they all accomplish it in a different way. For someone that did not match to a residency program last season, what are some things that can be done to improve their chances for this season? So that's a great question. I think one of the biggest things that you'll need to do if you didn't match is own that. Own that you didn't match, address it, and let us know why. Do you think that it was because you had a difficult time interviewing? Or maybe it was a socioeconomic thing. You couldn't make it to the interview, so it wasn't a good representation. So let us know why you thought it didn't, and then let us know the steps you take to correct that, if it was a correctable thing. And if it wasn't a correctable thing, it was situations out of your control, let us know that also, because we need to know those things. Some people look excellent on paper, and then you get them in front of you and they're very bland and you're like, you know, and then some people look okay on paper and you get them in front of you and they are just simply phenomenal. They're energetic, they're excited, they know a lot about the program that they're applying to and currently interviewing with, and that really comes off in a different manner. Make sure to be involved in something that is medically oriented over this next year. We don't like to see you sort of just picking up a random job, and if you do have to pick up a random job for money, then make sure that you are spending some spare time keeping up your skills. Because we always want to be able to say, well, you know, it's only been a year and they've been shadowing with a pediatrician for the past year or so. They've been around medicine and they still know the ins and outs. Kareem, would you like me to go a little more into that, or is that enough?
No, that makes sense. Thank you so much.
Yeah, absolutely. So the next one I have here. What will you look for in the personal statement? How long should it be? You guys have great questions. One of the key identifiers in a personal statement is what is bringing your passion to whatever specialty that you're choosing. For me, I went way back before I was in med school and I was a manager of urgent care center. And I saw someone come in and he slapped his finger on the table and he had this overwhelmingly infected middle finger. And he looked at me as a manager and he said, do you think this needs to be looked at? At the time, I didn't have any medical advice. I simply said, I need a provider to look at it. The provider came out and they said, well, you need to be looked at now because it's on a special area that I didn't understand at the time. And he said, well, here's the deal. I have my niece's baptism this afternoon, which is actually how I injured this finger. So can I come back after that? So because the provider told him he had to stay, I had him sign an AMA, came back in later on that day, and turns out he had a nail head stuck in his finger. And the only reason I knew that was because I was holding the fluoroscope on the entire time as two of my other providers were digging the nail out of this man's finger. So some sort of story, something that's grabbing, something that makes us know what and why the specialty that you're choosing. And then if you really want to kick it into overgear, dedicating a portion of the personal statement to why the specific program that you are applying to. So in my residency application, I knew we did a lot with a Falcons Children's Home, and we went there and we provided children to at-need children for free cost. And I mentioned that. So it displays that you have a knowledge of what the program does, and it also shows that you have interest in something that may be unique to that program. Yeah, good. So some questions that we like to hear from you guys are directed at your knowledge of us. So here at Beebe, we'd be a new program. So asking us, how do you feel about, how does the culture feel about residents in the area? Something that would demonstrate to us that you're researching us. I think directed questions during your interview are always a good idea. For program directors, it's always great to ask, what's your 5-year plan for the program? Because a lot of program directors aren't thinking just about this interview season, but what are we going to do when we have a full boat of residents, and what is everything going to look like then, and how can I make it better? Let's see. Sorry, got another one here. Samantha. Hey, Samantha. An MS for CUNY. Hey, go to New York. I'm from New York originally. FMEC in Virginia. Oh, that's a great question. So it was actually between Beebe and my previous institution for faculty. Both of them had offered me the same sort of thing. What I loved about Beebe was the support. And then you'll find as you go on in your career, support from every level of clinical and administration is a great thing to see. When I interviewed here at Beebe, I met with the CEO, I met with the DIO, I met with all sorts of O's, essentially. And every one of them was excited, was realistic, had great goals, had excellent motivation to have residents in the program, to bring an educational and an academic medicine to this area. So in the end, it really pushed me overboard for that. Absolutely. So the question is then, there's no residents to talk to now. So how would you learn about us? Aside from talking to previous residents, we have a group of core clinical students here from PCOM. They are here and they're rotating through all the traditional rotations of 3rd year, which in honesty is a pretty good mimic of what you'll be doing in intern year. So speaking to the students that are here is a great way, and reaching out to me or Dr. Robert with questions. We will happily reply back, and we can tell you about more of the structure of the program and where we are and where we see it going. Dr. Robert has great vision about the entirety of the program, and so does our DIO, Tanya, who's also on right now. So if you wanted to find out more things, we have a Facebook page. We've got a dedicated page on bbhealthcare.org for the family medicine residency program. And it lists the faculty and core faculty and program director and who we are as people. And it can even give you a little insight into what we like to do.
Dr. Arias, can you?
So one of the things that I absolutely enjoyed talking about during residency interviews was something that made me have a better feel for who people were and be able to remember them later on. So keep this in your back pocket. Talk about a hobby that you like to do that isn't necessarily like a run-of-the-mill kind of, you know, I like to exercise or read a book. And if you cook, say what you like to cook. Be very specific about it, because when we see something that is interesting or you're very specific, we're more likely to remember who you are. For instance, I had a few different people that tell me they like to make macaroons. And in my mind, I still remember their name to this day. And interview season was, you know, last year. So having something in your pocket like that to make you stand out, like, I like to cook macaroons. Well, what kind of macaroons? One made them out of almonds, one made them out of coconuts. I mean, I learned more about macaroons from this than I ever did on the cooking channel. So there it is. Tanya just posted here our web page. Got a great bunch of information on there. Thank you, Tanya. Yep, and our IG and Facebook. And there's our email for everyone there. So as far as interviewing goes, it's a very stressful time. There is, sorry. Do you have a suggestion on how to become a year of graduation filter for older grads? To be honest with you, if you're very interested in a program, email them directly. Don't just rely on ERAS. We all have emails posted up on the website, and take that situation into your own hands. So let us know. Say, hey, I submitted an application to you. I'm very interested in the program. Can you please take a look? I'd love to be able to speak to you guys. And if nobody responds, then you're left in the same place. But if we get back to you and we say, hey, yeah, sure, wouldn't you like to schedule an interview, or here are our interview dates? Well, you've gotten yourself one more than you had before. So in this process, it's a very arduous process. It's a long process of interviewing. But to do stuff like that, you can directly outreach, and sometimes that goes a long way. Involved in several community outreaches past few years for promotion various mechanisms. Absolutely. I mean, highlighting the individual accomplishments, community outreaches, all those things should definitely be part of your CV. And if asked, you should be ready and available to talk about them and what they all entailed. And they should definitely be part of your highlights, because that's not just run-of-the-mill, going to medical school, going home, studying, doing well, going back into school. So anything that you've done extracurricularly while still doing well in medical school should be a highlight that you have.
Dr. Arias, it's Tanya. Can you hear me?
Yep.
Okay. My internet went out before, so I just check in. I just want to give one recommendation too. So professionalism and how you treat the staff, especially the program coordinator, while you're going through this interview process and scheduling your interviews, or if you have to reschedule them, just being extra nice. That the program coordinator is quote unquote the gatekeeper of the residency. And you know, how you treat them is a reflection on your professionalism, and it's something we will take into consideration too. So just a recommendation when scheduling your interviews, being very professional and polite with the program coordinator and office staff.
Yeah, I can't echo that anymore. Professionalism is huge. Making sure that you are polite. You are always under the spotlight when you are interviewing. So making sure that you are polite, that you're professional, that you are nice, is the best. And then Dr. Robert, she also just joined, popped up. Let's see. Thank you, Dr. S. Done medical missions in Haiti with doctors and nurses from Christiana Care. Oh, yeah. I mean, if you feel like this is something that you can tie into your personal statement, as far as if you want to do family medicine and you're very interested in community outreach and medical missions, then for sure highlight this, because that's a great, unique, integrative medical experience, and that's something that you should definitely put on there and highlight if you can fit it in and it flows. So, and then I got another question here about the note post interview. So this seems to be a new phenomenon within the past couple years. Sort of, they call it a dedication note. So this is one of the notes that you send out. They say, you know, I am ranking this program #1. The only advice I can give you there is do not attempt to game the system. If you are telling a program you're ranking them #1, they had better be the only program that you are ranking #1. Do not tell multiple programs that you are ranking them #1. Program directors know a lot of other program directors, and the world is small in ACGME. You can ask Tanya and Dr. Robert. Somehow they knew my former director of medical educator, out of the blue. But word will get around. So make sure if you're going to give one of those quote unquote post-note devotion letters, and you're going to rank someone #1, that they are the only place you're ranking #1. Now, as far as reaching out and thanking everyone, I had a great time, very interested. I love the staff. I love the residents. You can create however many of those notes or postcards or emails as you want. Things you won't hear back from us is that we're ranking you high. We're not allowed to say those kinds of things, but we will always respond and say, thank you. It was a pleasure to have you. You know, you were great. Thank you so much. Let's see. How important is research/publications for family medicine specialty? I think classically, we haven't been so great at it, but within the past 5 years, this is a big push. We want and do practice evidence-based medicine. And with that comes research and publications. Now, it's incredibly difficult to get huge, unwieldy research under your belt as a medical student, but being a part of the process and being able to document that is very helpful. For instance, I was a part of a poster project that created a wellness program in my 3rd and 4th year with some of the existing residents. Now, I didn't see it to completion because the residents had finished it up, but I was still a part of it, and we won as a poster in a North Carolina AFP competition. So being able to list something like that does go a long way. It shows that you are, one, again, involved in something that is extracurricular, and two, that you do have an interest in doing research and or publications. Sure. So I'll just sort of continue talking here as more questions roll in. As far as the interview process goes, when you're towards the end and you're getting tired, if you do have to cancel, make sure you do so in a professional manner. Don't just not show up, because that's a valued spot. That is a spot that somebody could have taken who maybe really wanted to come to the program or was very interested in the program, but that you had, and then you said you were going to. So January, February, you start to get tired. There is interview fatigue. But if you feel like at any point that you are going to not be able to make those interviews, reach out early. And if nobody responds, reach out often and let them know that I'll have to cancel. I'm very sorry. Thank you for the opportunity. Nobody likes being ghosted, quote unquote. Oh, okay. Let's see. From New York. So I lived in Long Beach, Long Island. And how does practicing medicine in a small town / suburbs compared to living in the city? Uh, to be honest, I like it a little more. Where I practiced, it was more rural. It's like Beebe here. And that gives you, as a family medicine provider, a little more purview. And as a family medicine resident, there's not as much in the way for you to have to compete with. As you become more independent, you want to do more independent kind of things. So one of the sort of pitfalls of being in a larger place is that a larger institution invariably means more residency programs. So instead of me being first assist on an exploratory laparotomy on a patient who had ischemic bowel and was dying, that would have been a 4th year or 5th year general surgery resident who was there, and then all the way down the chain until I would have even been able to lay eyes on them. So the competition isn't as large, and you get to do a lot more things. I personally have been able to do intubations, run codes, put in central lines, paracenteses, thoracenteses. Whereas if you were in a larger institution, you may be competing for those with the internal medicine residents or pulmonology doctors or GI residents or any sort of specialty that you can imagine there. On the flip side, you're not exposed to as much, but a lot of times as a family med doc, you will not be managing somebody who has, transposition of the great vessels. That is a surgery thing and a neonatal intensive care unit thing, but you get exposed to it. You're the stabilizing doctor when that baby comes out of the womb, and that SpO2 won't go above 75. So Tanya, can you handle that question? Will be IMG friendly?
Well, sorry, Dr. Ayers. I did want to answer Samantha's question. Sorry, Doctor. Sorry, I came on late. Dr. Robert, I'm the program director. I'm glad that we have a good group tonight. Just to answer Samantha's question about New York, I was born and raised in New York. And I definitely like practicing out in Delaware. One of the great things about being a family medicine physician, when patients come to see you, they want to use all of your skills. So sometimes in New York, it'd be a little bit fragmented. They want to see GYN, they want to see this, they want to see that. I feel like when I see patients at our long neck clinic, a lot of times they're like, oh, you do pap smears, I'd rather just see you. Or you can do this, I'd rather just see you. So they're like, you're my family doctor. So sometimes I think the patient population we see here, the expectation is you're a family doctor, you're going to use all your skills, which I think is great for a residency program because you'll be able to learn and encompass all the different skill sets of pediatrics, gynecology, adult medicine. So you're really using your full scope. So sorry, Dr. Arias.
No, yeah, great.
I guess Tanya can answer that question.
Sure. So the IMG question, yes, we are going to be IMG friendly. Of course, we will approach all application review in the holistic manner so that we're getting the best candidates and the most diverse candidates to serve our patient population. Unfortunately, we're not able to support H-1B visas, and we'll accept J-1s on a case-by-case.
Thank you, Tanya.
I'll answer the second one too about observerships and externships. Yes, hopefully. We're just starting to allow observers back into the environment after we paused everything with COVID. So I'll keep you on the list. I don't think it's going to happen in the next 6 months, but something we are looking to start in the future.
Shirley.
You're welcome. So Shirley, so typically your rank list is due early February, mid to early February. So I would say before January is a good time to get your 4th year audition in, before then. And
to add on to that, prime prime time interviewing season is, the October, November kind of realm. So if you're really interested in the program, maybe you want to set up an audition during those couple of months so that you're around, they know you, your face is there. The audition season is just like the interview season's red hot and everybody's thinking about, oh, is this a potential candidate? Look, she's been here, she's doing well. Maybe she would be great with this program, sort of deal.
Yes, and we will accept either 2-week or 4-week rotations. I think I froze again. Can you hear me?
Nope, I hear you.
Okay. So we'll accept either 2-week or 4-week rotations, and you can just shoot an email to that FM residency box, and I'll happily get that scheduled for anybody.
Thank you, Shirley. Did a great job. This block. I think you're up again, Tanya.
Yeah, so unfortunately, the IMGs would fall into that observer shadow category, and we're not able to do that at this time. We're only able to do audition rotations for students currently enrolled in medical school. But it's something I am working on. We'll match through NRMP. So as soon as we have our accreditation, we'll register for ERS and NRMP, and we'll be doing everything through NRMP.
So I can definitely elaborate on at least the OMT part, because I just started here about a month ago. But OMT, I love doing OMT. I do what I like to call functional OMT, where it is incorporated in a patient visit. I document osteopathic findings. And then if they need, or I think they would benefit from more osteopathic manipulation, I'll schedule them at a later point in the next couple of weeks for a dedicated time period for that. There is, I know, a population for the LGBTQ community here, and they have, special access and needs sometimes, and we offer those. Beebe is great with offering various community health programs. We have a monkeypox vaccine clinic that's up and running currently. And so the world is sort of the oyster here. We got a good population to treat and have as patients. For the best resident you have worked with, what made that individual outstanding? I guess I can take it, and then Dr. Robert, you can give one of your examples. One of the best colleagues, or even students that I worked with, the best feature was showing up and caring, to be honest. Dedicating time, looking stuff up, having a plan, some sort of plan ready, and being able to synthesize, take feedback, and apply it later on for same kind of situation, but on a different person. Somebody who was enjoyable to be around, wasn't always serious, but was always professional, and just had a good heart. Those were some of the best people that I've ever worked with.
That's a good question. So for me, I've been teaching for like over a decade now. This is something that I'm very passionate about, teaching medical students and residents. I can think about one really great resident, and I actually known this person since he was a third year. he rotated as his 3rd-year clerkship. And then he did a sub-I when I was on, inpatient service. And then he did a TY year when I was TY program director. And then he ended up going into our family medicine residency program. So I've known this person for about maybe, my math is bad, like 6 years since he was a 3rd year, so about 6 years. And now he's a 3rd-year family medicine resident, and he's going to graduate and be on his own. And I think what really stood out to me, him as a resident, is really his compassion that he had for his patients and resiliency that he always, he was there for his co-residents, was very professional, like Dr. Arias said. I think that's a huge, characteristic that we look for in a resident. Someone who's willing, and someone who's also personable and a team player. I remember during COVID, he really stepped up, and, it was tough, but was always a team player. It was rough, but he was there to support his fellow residents. So those are the things that we look at, or I certainly look at when it comes to a resident.
So one of the advantages that you'd experience here, if you were to come here, is an unopposed program. Over the years of training that I had, I met a lot of different kinds of FM doctors. I met some in the ER. I met some who worked inpatient. I met some who did FM OB, who went on to practice a lot of OB and had their own clinical days to get dedicated for pregnancy and perinatal and prenatal visits, and even did cesareans. And almost every one of them, when I asked them, what did you enjoy most about your residency, that all of them attended an unopposed residency. And I thought that was interesting because, when you're in medical school, you always think about having all these other residents around you, and like the bigger the community, the better things are going to be. What invariably what each one of them said was, I got to do a lot. And some of my attendings who were from big fancy places like UNC, Chapel Hill, and did their residency there, one of them, I'll never forget her name, was Dr. Hathaway. Dr. Hathaway was triple boarded in inpatient. She was a hospitalist. She was boarded in geriatrics and nephrology. And in my 4th year, as I was interviewing and trying to decide where to be for residency, if I wanted a large place or a small place, I contacted her and I said, Dr. Hathaway, you have all these degrees, you were made for hospital medicine. And she loved it. She truly enjoyed it, and it came out in her teaching. I said, but why do you practice medicine at Harnett Health, which was in Harnett County, 40 minutes south of Raleigh, the nearest biggest city, and at least an hour and a half away from Chapel Hill, UNC Chapel Hill, or even Duke? And she looked at me and she smiled and she goes, I get to do a lot more here. And that struck me. And every one of the other attendings struck me too. So whenever you are thinking about where you want to go, one of the advantages we're going to offer here is that it will be unopposed. You will be looked to be learning how to do those central lines, to be affluent in doing joint injections. You will get a broad scope of procedures that you may not get at other places. So doing a lot is also a big factor in trying to decide where you want to go. Are you going to be the kind of person that when someone comes in, you can manage the disease, you can start the workup for their lupus, you can start the medication, and then refer them to a rheumatologist? Or are you going to be a person who suspects a rheumatological disorder and sends them over to rheumatology without being able to have that background or foreground knowledge? So these are some of the things that you can think about as you're out on your rotations. How many other people are going to be around before I get a whack to do something? to get certain hours of OMT training to be considered for DO funding programs. If you can please share, way to enroll for it. BB, FM, BB. So for MD applicants, right now we are not going to be osteopathically recognized. That will be something that I will be partaking in as the years go on. But as it goes, if there is an osteopathic recognition, MDs can choose to either enroll in that track or not enroll in that track. So if it is something you are interested in doing, you can enroll in the osteopathic recognition track, and by the time you graduate, have acquired a sufficient amount of hours to establish you as knowing about osteopathy. And then there's always certifications you can get after your career in residency that will allow you to practice OMT. And I'm very sure, but Tanya, correct me here, Beebe will definitely be a DO, MD combined friendly residency.
Oh, absolutely. Yes.
Yeah. Awesome. So before we sort of end here, Tanya or Dr. Robert, do you guys have anything else you'd like to bring up or talk about?
Yeah, sorry, I don't know what we'll shared in the beginning, but just want to share just our excitement with starting a new program. I think, you know, we have great things to come, and we have Dr. Arias, and I know Dr. Arias did a fantastic job leading the group. And I'm so happy that you decided to join Team BB. And we appreciate your DO skills. He helped me out with a patient with TMJ disorder the other day. So it's always good to have a DO on hand to help me out with that. But yeah, so to all you guys on the call, stay tuned. We'll be getting our accreditation November 4th of this year, and we'll be accepting, you know, we'll enter the ERAS and looking at applications and starting our interviews probably a little bit later on in the season, around end of November, probably most likely beginning of this December. So we're looking forward to seeing your applications and meeting you guys in person and come down and see what we're all about. So, and just like Tanya said, you can use that, it was an FM residency at bbhealthcare.org if you have any questions, and we'll certainly be able to answer them for you. But thanks so much for coming out tonight, and tell your friends and colleagues to apply to our program. I don't know if Tanya, you've got anything you wanted to add.
I think you guys covered it. I mean, follow us on Instagram and Facebook. We'll be posting updates and introducing all of our faculty, highlighting some of our great core clinical campus students. So keep posted, keep us in mind, and we look forward to meeting you all soon.
Right, and I'm not sure if any, so I will be at the FMEC, the Family Medicine Education Consortium conference in Arlington just in a few weeks, myself and our associate program director, Dr. Hatoff. So we're doing a breakfast discussion, and we'll be talking about the implementation of UME, undergraduate medical education, and graduate medical education in community hospitals. So if you will be at the conference or know anyone who will be there, definitely join us. We'll also have a recruitment. Well, we won't be with the residency recruitment, but we'll have a physician recruiter from Beebe there as well. So if you're there, hopefully we can meet in person then.
Okay. I just want to say thank you to Dr. Arias, Dr. Robert, and Tanya for this great evening, and congratulations on your new program. I hope you get a lot of great applications, and thanks everyone for joining us tonight. If you have any questions, they shared their email in the chat and verbally, and you can always reach out to FMEC. We'll help you connect if you're having trouble.